Hello, and thank you for joining us today. We are the young doctors from Medical Women Association of Nigeria, FCT chapter. Today we're going to be talking about breastfeeding to commemorate the International Breastfeeding Week. And the theme for this week is Step Up for Breastfeeding, Educate and Support. We have some lovely doctors here with us today, and we're going to address some pertinent questions that need to be answered about breastfeeding. So first of all, I'm going to ask the doctor on our right here to introduce herself and talk to us. What is breastfeeding, and where does breast milk come from?
Okay, so thank you very much. I am Dr. Kelechi Izwabwa. I'm presently working with the Limi Hospital, Central Business District, Abuja. So talking about breastfeeding is when a child is directly breastfed from a female breast, okay? So what is optimal breastfeeding? Of course, we know that the WHO always advocates that we optimally breastfeed our babies. So what is optimal breastfeeding? Optimal breastfeeding is when you breastfeed a child for up to 6 months, okay, without any additional thing like water, except or even medication, except if medically prescribed, okay. So having said that, we also have complementary feeding where a child is being breastfed, but other complementary feeds are introduced to when the child is up to 2 years of age or even beyond, okay. So I would like us to know about how breast milk is brought about. Okay, so when a child suckles directly at the female breast, so there's this sensory impulse that gets transmitted to the brain, okay, so that the milk is let down. So when this impulse gets to the brain, it goes to the anterior pituitary and the posterior pituitary, where some hormones are produced, like the Prolactin, which is produced from the anterior pituitary, and the oxytocin from the posterior pituitary. So from when this child suckles at the breast, so this Prolactin is released from the cells around the breast, so that this child gets enough milk at a time. So this Prolactin stays in the blood for up to 30 minutes, okay, per each feeding. So the oxytocin also is released when there is impulse transmission to that posterior pituitary gland, where the milk is let down. We call it milk letdown reflex, okay. So this oxytocin helps to cause release of this milk by acting on the sinuses of this breast, so that milk production can be brought to the child. Thank you very much.
Thank you for that insightful answer. So I want to know, what is the composition or content of this breast milk? There's a doctor on my extreme right. I'm going to pass it over to her to respond.
Hello everyone, good day. I am Dr. Fatima Dambata, a medical officer with Medic Aid Radio Diagnostics. So when I'm talking about the composition of breast milk, the first thing that is important for me to emphasize is the fact that for the first 6 months of a child's life, breast milk contains everything the child needs to be able to grow properly. It contains full nourishment. I am emphasizing on this because I have heard people complain a lot of times that, how about water? Don't we need to give the child water? So no, you don't. For the first 6 months, breast milk is a complete meal till after 6 months, when you'll need to introduce complementary feeds. Breast milk contains all the classes of food. So we're talking about carbohydrates, proteins, a lot of proteins, because protein is important for brain development at that age. There are immunoglobulins, which are the fighters that help to protect children against diseases. We have minerals, we have vitamins, and we have fats. So from the first day of life till the 5th day, the milk that is produced is known as colostrum, which is a yellowish type of milk that contains a high amount of protein, water, and those immunoglobulins that I spoke about. Now, a lot of people feel that because of the color of this milk, it's unclean or not safe for the child yet. But missing this milk predisposes the child to infections. Colostrum also has an advantage because it has a laxative effect and helps in the excretion of bile from the intestines, preventing a phenomenon known as breastfeeding jaundice, which occurs sometimes around the 3rd to 5th day of life. Then we also have the mature milk, which starts getting produced after colostrum, about 15 days of life or so. So between colostrum and the mature milk, we have the transitional milk, about 5 to 15 days. Then from the 15th day of life, we have mature milk, which is divided into the fore milk and the hind milk. The fore milk is the watery part, almost grayish in color, that begins to come out of the breast when breastfeeding is initiated. Now, this milk has more water, and the hind milk, which comes after, has more fat. Another thing to emphasize is that when breastfeeding a child, it's important to make sure that you breastfeed from one breast at a time, so the child gets both the fore milk and the hind milk, thereby not losing any of that liquid gold that it's called by some people. Thank you.
Thank you so much, Dr. Fatima, for that insightful response. So we talk about this breast milk that has so many important contents, and you said it's liquid gold, right? So I mean, people choose that. I mean, I don't have the time to breastfeed. I mean, like, we have this infant formula that has, maybe the same content, and why should I bother breastfeeding? So please, doctor, can you tell us about the importance of breastfeeding? What's the advantage? Why should we even bother?
Thank you very much. My name is Dr. Areola. I'm a medical officer working with Garaki Hospital, and I would like to say there are so many benefits, several benefits really to breastfeeding a child. These benefits include both to the baby, to the mother, and to the community. This is how I've divided it. Now, to the baby, it confers immunity. It confers immunity to the child, and this, like my colleague said, this actually protects the baby from getting infected. Now, some will say that with formula you're going to mix water with it, and you're going to give the baby drinking water, which can actually further predispose the child to infection, because you don't know the source of the water you're giving to your child. So I would like to say that your breast milk already contains enough water for the child, and it also contains the right balance of nutrients needed for growth and development. One of the kind of nutrients that this breast milk contains more than the formula is the protein. It contains higher amounts of protein in the breast milk contains higher amounts of protein. Also, it reduces risks of allergy. We talk about asthma most of the time, and one of the things that we don't know is that, like my colleague said, the colostrum contains some immunoglobulins that actually prevents the child from having allergies and the likes of asthma. Okay, and it also contains mild laxative, like my colleague said, and prevents against jaundice, and it helps these babies to have high intelligence quotients, okay, what we call IQ, and it is readily absorbed by the body. It's easily absorbed, and then to the mother, it helps the mother to have a mother-to-child bonding, and it also helps the mother save time and helps the mother, have this. It's a form of contraceptive per se, so it helps with child spacing, and it's also known to reduce, some risks of cancer like breast cancer and ovarian cancer, and it helps with weight reduction also. And to the community now, funny as it is, it also helps with environmental waste. It helps us to reduce littering and loitering of cans and whatever that we use in making up the formula in the environment. Thank you very much.
This is amazing. I mean, why I wish I could breastfeed right now because there's so many advantages. But when we talk about advantages, obviously there may be some, some problems, some things that may not go as planned. So, like, Dr. Please, can you tell us about the problems or issues that could go wrong when a woman is breastfeeding?
So, some of the complications of breastfeeding that mothers experience while breastfeeding their babies is, now, if you have a baby that is not suckling because maybe you didn't start secreting breast milk in time, and then the baby is used to formula and you're trying to wean the baby off formula to go back to breastfeeding, it may be difficult as the baby is not trying to suck on the breast. Your breast is going to be engorged because you're secreting breast milk the baby is not sucking. So that breast milk will fill your breast and your breast will become engorged and the mothers experience pain. Now, aside that, the breast can get inflamed, what we call a mastitis, because of that engorged breast. That milk can be a breeding ground for some bacteria, microorganisms to grow and cause the mother more pain and fever. And also, when the baby is suckling, after a few months, the baby start developing the milk teeth. They can use that to grab on the nipple and cause little breakage on the skin of the nipple, and that injury also can be a source of infection to the mother and also cause pain. Now, because of this and improper breastfeeding, the WHO and UNICEF launched the Baby Friendly Hospital Initiative in 1992, which is to help hospitals to practice and support breastfeeding globally, to help and empower women who breastfeed to start from the first month of the baby's life up until 2 years of the baby's life. So to ensure optimal breastfeeding, they brought up the 10 steps to successful breastfeeding, which must be practiced in hospitals, one of which is to have a written breastfeeding policy in all hospitals, and this should be communicated to all health staff so that they are well aware of this and also trained to establish this policy to make sure that it's properly followed. Also to inform all pregnant women about the benefits and management in breastfeeding and the advantages in breastfeeding. Also to initiate breastfeeding in time from at the first hour after delivery. A mother should put the baby to breast even when she is not secreting, because like my colleague had said earlier, that stimulus from the baby's cry for the breast milk or for food will make her secrete the breast milk, so it also initiates the baby and the mother to bond as well. These and other policies that right now I cannot think of are part of this breastfeeding policy.
Thank you so much. That was a very good answer. So obviously there are some misconceptions and other problems that women encounter when they are breastfeeding. So Dr. please, could you throw more light on this?
Thank you very much. So it's been said that some people believe that the first milk that comes out from a woman's breast as soon as she initiates lactation is dirty milk. Okay, people always assume that it's dirty milk. So that's a misconception. That is not dirty milk. Actually, that milk is in fact the first immunization the child gets. Okay, that's the colostrum. Okay, so we always advise that breastfeeding mothers shouldn't discard this colostrum, which is the first breast milk that is secreted when lactation is initiated. And then secondly, it's been said that small breasts equals small breast milk amount. That's really false. Okay, every breast breast size produces the same amount of breast milk. It's also said that breast milk, the breast milk is dirty. Okay, so that it should be discarded. I've said that earlier. So that's the colostrum. It shouldn't be discarded. Also said that breastfeeding decreases sexual appeal. It makes you not to have good sexual activity. That's really false. Also, some mothers will tell you that breastfeeding makes their breast to sag. Okay, that's really not true. okay, is really not true. Breastfeeding doesn't make breast milk to sag. In addition to that, there are other problems people have because of breastfeeding. Some will have some medical conditions like HIV, hepatitis, so they will say they don't want to breastfeed. That's not an absolute contraindication to breastfeeding, okay? Transmission of other infections, they're on drugs, cancer drugs, and so they shouldn't breastfeed. Then most importantly, about positioning, okay, we'll talk about that when we are demonstrating on how you should adequately position your child, your baby, when you're breastfeeding. So these are important things that people should know about, okay? These are misconceptions all over the place that people should always bear in mind, okay? Thank you very much.
So I see doctor wants to say something. She wants to add to these misconceptions. Doctor, please.
Thank you. Just to add to the misconceptions that my colleague mentioned earlier, I would like to talk about two things, one relating to the child and one relating to the mother. So when you talk about exclusive breastfeeding, a lot of concern that comes up is that, will this breast milk actually be enough for my child? You're saying that I should give only breast milk, nothing else, will it be enough? So a newborn stomach is actually not that big. So we need just about 60 to 90 mils of breast milk every 2 hours in the first 3 months, and that amount increases to about 90 to 180 mils for 3 to 6 months. Now when you check this measurement, you realize that it's really not that much, and what you're producing in your breast. Now I'm saying for those that are able to produce breast milk, because there are those that for some medical conditions, for some other conditions, are not able to properly produce breast milk. But for those that are able to produce breast milk, that amount is actually enough to sustain your child for the first 6 months, and hence there is no need to shy away from exclusive breastfeeding. Concerning the mothers, I would like to talk about the issue of breast sagging. This cosmetic issue is one that we come across a lot. Breasts by their nature will sag, and breastfeeding does not really do much to affect that. The way the breast is, it's held up by strings, let's call them, called ligaments. Breasts will eventually sag, either because of weight loss or weight gain, some hormonal changes, aging, and so on. So what breastfeeding contributes to that is actually not much. So please do not deprive your child. If you're medically able to, you're medically fit, you're able to produce the breast milk, then there's no need to deny your child from having that because of the fear of sagging. Thank you.
Very well said, doctors. Thank you very much for your contributions. So finally, I would just say, if you're a woman and you're trying to even get pregnant or conceive, I think it's important to think about breastfeeding ahead. So what is important for you to do is to now start getting the right nutrition, getting the folic acid and everything you need to prepare yourself to be able to produce milk when the time comes. And also, make sure you, if you're planning to get pregnant, make sure you get to know your pregnancy status early enough so you can start attending your antenatal care visits. This way, you'll be adequately prepared to know more, because we can't exhaust everything you need to know about breastfeeding. To know everything you need to know about breastfeeding early enough and prepare yourself and have a successful breastfeeding period for you and your baby. Thank you very much for joining us today, and we'll see you next time. Bye. Okay, now we'll be going over to Zankle Hospital to join Dr. Jennifer, who will be demonstrating the breastfeeding techniques.
So the first breastfeeding method or technique I want to talk about is the cradle hold. Okay, cradle hold. You hold the baby in this position. You hold the baby in this position, very comfortable position. Baby's head relaxes around your elbow. Your hand holds. You hold the butt of the baby, and then you squeeze, or you put your nipple directly. For breastfeeding to be achieved properly, the baby should be brought to breast. You put baby to breast. You don't take breast to baby. You actually put baby to breast. So usually you sit in a comfortable position, get your back relaxed. My back is well relaxed in this position. So I just hold baby and put in this position. See? The cradle position, the cradle hold. The next technique we're talking about here is the cross cradle hold. Usually, if you can actually bring the baby from this position, just be feeding while maybe I'm working on something on the computer, or I have a project I'm writing on something. Just bring baby from this position, and then you put baby to breast while you're, do you understand me? Cross cradle position. It mimics like the football hold, but the football hold is more relaxing. You actually bring baby, you can bring baby in this position, and just this whole area will be free. You don't support with this hand, you can just keep the baby in this position, put the breast in the baby's mouth while you do other errands. You can do other things around it. That's the football hold. For twins, it's more comfortable. This football hold is actually comfortable for those who have twins. I don't have another baby. I mean, you know, you put them in the same position. Put one baby here, you put the other baby in the other position. Just like that, you hold them in this position. This one gets from this breast, this one gets from the other breast. That's the football hold for twins and the regular football hold. The side lie position or technique is, many of us on this table, it was actually my favorite position, breastfeeding my children, because you're tired and all. So you lie. I don't know how to demonstrate this for you. So let's see if, okay, something like, let's assume I'm lying in this position. I'm lying down and you know, feeding my child in this position. I don't know if you can see what I'm doing from that angle. It's just like this. You put the baby of course is in the same position. Then you lie, side lie, you lie on the side while you breastfeed your baby. Supine position is that you lie on your back and then you just put baby to breast. Put babies, let me come close so that you see what I'm talking about. Side, supine position or lying position that you lean back position. You lie on your back, relax on your back, and you put baby's breasts. Baby's mouth directly into the breasts. Then we just take breasts from this position. So there's also the upright position where you can put baby. Let me remove baby's. So you put baby's legs apart, sort of, and just put baby to breast in this position. Like baby puts the legs just like this. Baby is just facing you directly. Then you put breast on baby's mouth. Then the dangle free position, the dangle feeding position, is where it's the same as the side lie. You just lie on the side and let the breast hang, just dangle, and then just put breast into it. You just relax and then you put breast into baby's mouth. So that is it. The reason why these techniques are being discussed is because of the benefits. Many people don't like breastfeeding because of the soreness that comes with it, because that's where we talk about proper latching. The baby needs to latch properly on the breast. Baby's mouth needs to cover this whole area, this areola area, this axis. The baby's mouth needs to cover this whole area. The baby has to open the mouth wide and put latch. And breastfeeding is actually not painful, as some people think it is. It's not painful. If baby latches properly on the breast, you don't have breast pain. You don't have soreness of the breast. Another thing is that baby has to empty one breast. Baby needs to feed properly and empty the breast before you move to the other breast. Why? Because when baby starts feeding first, the baby gets water to quench thirst. And then after a few minutes into breastfeeding, the thick part of the milk comes, which actually satisfies hunger. Baby needs to breastfeed on one breast before you move to the other breast. Empty one breast before you move to the other breast. Another thing is when your baby is smacking, when you're hearing it smack, you know your baby is not latched properly because baby is taking in air, and that sound, the baby is smacking the lips while sucking. The baby is not latched properly, and that's how they get in air, so they get to swallow air, and before you know it, they have infantile colic. You're coming, baby screaming, wriggling, and then squeezing, with all the pain and all the crying. It's one of the reasons why baby have infantile colic, because they have swallowed in lots of air. So I think I've covered the basic breastfeeding techniques, and it's important that we know these positions and techniques, because it's both beneficial to the baby and to the mother. So I want to appreciate each and every one of us who paid attention to this video. My name again, I will introduce myself once more. I am Dr. Amilubi Jennifer. I work at the Pediatrics Department of Zankli Medical Center, and once again, I welcome you to the World Breastfeeding Week. Don't forget the theme: step up for breastfeeding, support and encourage breastfeeding women. There are several ways we can support our partners who are breastfeeding, both at work and at home. We could help them because it's not very easy to breastfeed, especially those who have twins. Even one child is a handful already. So, one support our partner, let them have enough rest, help them with chores, with meals, massage their back, help them with the baby so they can get enough rest, because anxiety also doesn't help breast milk production. So we want to support our partners at work. We support paid leave for these women so that they can actually practice what they've been taught at the hospital.
Thank you so much, Dr. Jennifer. That was such a beautiful demonstration, right? So this is it from us at the Young Doctors Forum of the Medical Women Association of Nigeria, FCT chapter. See you next time. Bye.